Senior Lecturer in the University of Lahore. Warm welcome to all of you in this webinar hosted by the Afro-Asian Institute of Medical Sciences. Topic of this webinar is structure and the movement of joints. Keynote speaker is Dr. Muhammad Sikandar Ghayas Khan. He is Associate Professor and Head of Department in the University of Lahore. He is eminent researcher, great teacher, as well as he's a good administrator. He is a renowned speech language pathologist, and he is really a very good human being. He is also an actualized person. I am very much sure he can mesmerize you with his knowledge. Let me say warm welcome to Dr. Muhammad Sikandar Ghayas Khan. Sir, thank you so much for joining us, and I'm feeling so glad to introduce you. Without wasting any time, I would like to request you kindly share your knowledge on this topic. Your mic is open. You can start your presentation, sir, please.
Thank you, Rajat. First of all, I will thank you to the Dr. Professor Gilani and Afro-Asian Institute of the Medical Sciences and the University of Lahore, an organizer who is designed and prepared this webinar. Thank you so much. Today our topic of discussion is joints and the movement of the joint. So Allah has bestowed the human being with the wide variety of the joint. Human being having a 360 joint and 206 bones. While there is a 360 joint and 206 bone, because one bone forms more than one or two or three joints. First of all, what is the joint? Joint, we can define that where the two or more than two bones combine together, and it may be possible joint is mobile joint or immobile joint. The other name of the joint is orthosis. These are some important joints which are present in the body. For example, the pivot joint, ball and the socket joint, hinge joint, ellipsoidal joint, saddle joint, and the gliding joint. What are the functions of joint? Main function of the joint is to provide the mobility to the body, to hold the skeleton together. Other function of the joint are they also protect the internal organs. For example, the skull or the cranium is protect the brain, and thoracic cage is protect the heart and the lungs in the body. Also, the joint provides the structure to the body. We are dividing the joint into the three bases. First is on the basis of the structure of the joint, on the basis of function of the joint, and on the basis of movement of the joint. On the basis of the structure of the joint is divided into the two types further, solid joint and synovial joint. Solid joint is this type of the joint having the connective tissue between the bone. And in the synovial joint, there is the synovial cavity present between the joint and having the synovial fluid. The solid joints are further divided into the two types, the fibrous joint and cartilaginous joint. In the fibrous joint, there is the fibrous tissue present between the articular bones. The example of the fibrous joint are suture of the skulls, gum fosses present between the gum and the tooth, and the syndesmosis, which is present between the long bone. Actually, here the long bone not directly joined with each other, but they are joined with the help of the interosseous membrane. This joint also present in the long bone of the lower limb, tibia, and the fibula. Other type of the joint, solid joint, are the cartilaginous joint. Cartilaginous joint are further divided into the two types, the primary cartilaginous joint and the secondary cartilaginous joint. The example of the primary cartilaginous joint is the synchrondosis, This type of the joint present in the long bone or ending of the long bone. In this type of the joint, there is no movement present in the joint. Secondary cartilaginous joint, example are the symphysis, the joint present between the intervertebral disc or between the intervertebra, the disc present between the vertebra, and the other type is the pubic symphysis. This type of the joint present between the two hip bones. So it means that the solid joint are further divided into the fibrous joint and the cartilaginous joint. An example of the fibrous joint are suture of the skull, the kyphosis, and the syndromosis. Similarly, the cartilage joint are further divided into the primary cartilage joint and the secondary cartilage joint. Primary cartilage joint are present in the long bones and the secondary cartilage joint present between the vertebra and the pubic symphysis. This is the same thing. One more thing I would like to mention here, the suture are further divided into the two types, or some books are said that four types of the suture. I have mentioned here the four types of the suture. This type of the suture is according to the edges of the bone which meet together to form the joint. First type is called the serrate, it means to saw like the edges of the joint. And second is the denticulate, tooth-like structure of the bones meet together to form the denticulate type of the joint, which is the subtype of the suture. Squamous and the plain suture. Squamous, the two bones of the skull overlap together and to form the joint which we call the squamous joint. And the plain suture, flat surface of the bone when meet together to form the plain sutural joint. So these are the subtype of the suture, and subtype of the suture and suture are the type of the fibrous joint. Then kyphosis, also called the pec and the socket joint. Syndromosis present between the long bone of the body and the bone joint with each other with the ligament or the interosseous membrane. This is the tibiofibular joint, which is subtype of the fibrous joint. Then the cartilaginous joint, primary cartilaginous joint called the syndromosis, which is not an immobile joint at the end of the long bones present. Another type example is the vertebrosternal joint. Secondary cartilage joint, intervertebral joint, and pubic symphysis joint are the example of secondary cartilaginous joint. Another subtype of the joint is synostosis, which means that the joint is partially or completely sometimes are the cartilaginous joint. These are the structure which are present in the synovial. In synovial membrane, there is a cavity filled with the synovial fluid. Other structure present in the synovial joint are articular bone covered by the hyaline cartilage and also the two layer of the joint capsule. One layer, outer layer called the tough fibrous tissues, and inner layer is the synovial membrane. Besides that, the synovial fluid present inside the synovial membrane. Synovial fluid protect the joint for the wear and the tears. The ligament present around the joint will provide the strength to the joint. Now the tendon is the important thing which also help in the strength of the joint, and muscle are attached with the help of the tendon around the joint. The bursa is the lubricating device having provide the cushion and having a shock absorber properties. The meniscus are also the intervertebral fibrous fibrocartilage base or also present between the joint, large joint, for example, between the knee joint, and they provide the stability to the joint, increase the depth of the joint, and also for the stability and protect from the wear and tear from the joint. So this is the bursa. Bursa also present between the skin and the joint to decrease the friction skin on the joint. This is the tendon covered by the sheet. This is also to decrease the friction of the tendons. These are the main joint present in the body. So second main type of the joint are the synovial joint. Synovial joint are further divided into the multiple category according to the structure of the joint. First of all, there is the plain joint. Here in the plain joint, the plain articular surface of the brain to meet together the articular surface of the bone slide to each other. Therefore, the movement is the multiple direction movement, not a specific direction movement. The example of this joint is intercarpal joint, intertarsal joint, sternoclavicular joint, acromioclavicular joint, and other joints which are the type of this is the also there is the also particular space of the joint. And one thing I would like to mention here, because of the non-directional movement, on the basis of movement, this plain joint is also called the non-axial joint. Non-axial. Second type of the joint is the one fit into the concave joint, in which the convex and concave surface are combined to form the joint shape of the depression present in the other bones. This condylite joint is moved in two directions. There is the two movement. One is the flexion and the extension, and other is the adduction and the abduction is present in this type of the joint. Therefore, this joint also called the biaxial joint. Metacarpopharyngeal joint is example of the biaxial or condylite joint. So the saddle joint is two concave surface or saddle shaped surface combined together to form this type of the joint. Example of this type of the joint is carpometacarpal joint. This is also called the biaxial joint. So most stable joint of the body are the ball and socket joint. One bone having a ball-like structure and one bone having a socket-like structure meet together to form this type of the joint is called the ball and the socket joint. Example of the ball and the socket joint is the shoulder joint and hip joint. Now the other classification on the basis of the function, we have divided the joint into the three types, the synarthrosis, amphiarthrosis, and diarthrosis. Synarthrosis means immobile joint. The example of the synarthrosis, a joint present in the long bone, we have already discussed the primary cartilage joints is come in the category of the synarthrosis. Similarly, amphiarthrosis, the slightly mobile joint, the secondary cartilage joint come into the category of the amphiarthrosis. And diarthrosis are these type of the joint having multiple movement. For example, all the synovial joints are coming to the under the category of the diarthrosis. This is the second category of the joint on the basis of the function. On the basis of the movement, we have already discussed the movement of the joint, but here is the category of the joint which we have classified on the basis of the movement. Uniaxial joint, for example, the elbow joint, and they move the one axis only. Only extension and the flexion are present on the uniaxial joint. Similarly, the biaxial joint which move in a two planes or the two directions. For example, the wrist joint is moved into the one plane, anterior posteriorly, flexion and the extension, and other plane laterally and the medially called the adduction and the abduction. And third type is the multi on the basis of the movement, multi-axial joint, multi-axial joint are shoulder joint and elbow joint. They are move more than one direction, having a abduction, adduction, rotation, all movement present in the multi-axial joint. Example of the shoulder joint and also the hip joint. Now the structure of the joint or the shape of the joint is provide the strength to the joint. If there is a depth of the articular surface, they grip the other bone and having a powerful joint, and dislocation is less possible in this type of the joint. And also the ligament provide the support to the joint, arrangement of the muscle. If there is a more muscle present around the joint, chances of the dislocation is less. And also the soft tissue around the joint also protect the joint from the dislocation. Hormone in the use of the joint strengthen the joint. Regarding the blood supply of the joint, the arteries which are crossing to the joint from away the body and toward the heart, the branches of these arteries, small branches, combine together to form the anastomose around the joint. These anastomose provide the blood supply to the joint and the joint capsule too. Innervation of the joint or nerve supply of the joint, an important thing that the joint is supplied by the artery or by the nerve. The Hilton law said that the nerve which are crossing the joint will also supply skin over the joint, muscle over the joint, and joint itself. The sensory innervation of the joint is called the proprioception. Synovial membrane is relatively insensitive to the sensory information. The pain fiber are numerous in the fibrous layers. Therefore, the twisting of the joint are sensitive to the sensory information of the joint. The difference between the newborn skull is also called the, or skull cap, also called the clavum. The newborn skull is not meet together at the time of the birth, and there is a space present between the skull bones called the fontanelles and covered by the fibrous tissues. These fontanelles are completed after the 18 months or the 24 months after the birth. Degenerative diseases of the joints are very important clinical topic. Risk factor including the age, heredity, injury, and the obesity. Particularly those joints, hip joint, knee joint, vertebral column, and the hand. Some destructive activity also present from the jogging, jumping, and other stressful activities. Trauma to the joint may be followed by the arthritis or inflammation of the joint and the septicemia. Most common disease is the osteoarthritis, which is often accompanied by the stiffness of the bone, discomfort, and the pain. Other disease is the rheumatoid arthritis, chronic inflammatory disease, and marked by the flappy hand. This is actually the autoimmune disease. This is the three types of the joint. One is the normal joint, and other is the joint with disease osteoarthritis, and third is the rheumatoid arthritis. See the difference between these types of the joint. The normal joint having a normal structure, normal articular surface, normal ligaments, and space between the joint are present. This type of the joint is osteoarthritic joint. There is a decrease in a space between the joint and having increased the fraction of the joint. Chances of the damage to the bone is very high in this type of the joint. So the third type is rheumatoid arthritis. Rheumatoid arthritis, actually this is the chronic inflammatory disease, and the joint having a swelling, redness, and increased size of the joint. So clinical examination is needed for the diagnosis of the disease, and also the MRI and the CT scan. Arthroscopy was also used in the examination of the joint. The cannula in the arthroscope is inserted into the joint cavity for the abnormalities diagnosis and articular surface disc abnormality, especially diagnostic. Thank you so much. Over to the Madam Barira. Kindly open the mic, Madam Barira. Sorry, Madam Barira, kindly open the mic.
Thank you so much, sir, for sharing such a valuable knowledge with us. There are a few questions from participants. They want to ask question, how aging process affects the structure and the movement of joints?
Good question. This is a very common question because with the age, passage of the age, there is a weakness present in the muscles, and also the joint and the intervertebral menisci and the other structure are weaker. If you have a overweight, or even you have a normal weight and you are doing a stressful activity, the fraction of the between the joint and the muscles and the bone are increases that may cause it damage to the joint.
So another question from Laiba Zahid. She want to ask, joint pain is very much common in women, especially in later age. What is the reason behind this, and what a woman can do to get rid of it?
Yes, because of the hormonal changes, it is one possible reason is the aging, and other possible reason is the hormonal changing. Due to the hormonal changing, the structure of the joint also destroyed with the other body organ. Therefore, the women also feel the pain in the joint. And also, most of the women are overweight. It is the third reason that they can feel the pain into the joint. How we can get it from this pain? The one and the only best is to walk or run or jogging 20 minutes per day.
Right,
Another,
sir.
if you want to increase your nutritional habits, that will also helpful to decrease the pain on the joint.
Right. So is there any, you can say, diet can affect the structure of the joints?
Sorry?
Diet can affect the structure of
Yes, yes.
joints?
Why not? Why not? Diet is the very important nutrient in the diet present there, calcium and other minerals and vitamins. They also affect in the joint activity or structure of the joint.
Right, sir. Thank you so much, sir, for sharing your valuable knowledge with us. There are these questions which I have asked from the participants. Everyone is appreciating such a valuable knowledge you have shared with us. Thank you so much. And thank you to all panelists as well as all participants who joined us. Inshallah, see you next time. And as the Afro-Asian Institute of Medical Sciences is sharing a number of webinars, most of the people joining this and gaining the knowledge from this. Thank you so much, sir.